Good afternoon, Marines. My name is Sergeant Alpha Camp. I will give you some instruction over cancer. This is my public speaking class. My name is also Jacob Alpha Camp for those of you that can call me that in the future. In November 2008, my father was having hip pain and thought he needed a hip replacement. Upon getting examined, they found a tumor in his hip. Soon after many tests to find the cause of the tumor, they found the tumor had spread from his lungs to his hip, bones, and other muscles in his body. This is my father. On December 17, 2008, at the age of 54, my father was diagnosed with stage 4 non-small cell lung cancer. He was given a prognosis of 1 to 3 years. Prognosis means a lifespan, time to live, with an average of that being less than a year. Which pretty much means you go in, you get an appointment, they say, hey, your cancer is spread. What happened was it started in his lungs. He was a smoker for as long as I can remember, and it spread to other parts of his body. And the tumor in his hip was actually a result of what happened from when the cancer in the lung started. Cancer is a class of disease in which a group of cells displays an uncontrolled growth, invasion, and can sometimes metastasize. Metastasize means grow faster. It's an accelerated version of growing. Pretty much, it'll get bigger at a speed unknown to everybody. Cancer is very hard to catch if you don't take the right proper procedures and preventative measures. Quick cancer fact: cancer accounts for about 10 million deaths each year, and just lung cancer from smoking alone is 30% of these. So for those smokers out there, even nicotine, any types of nicotine, dip, stuff like that, it will actually increase your chances of different types of cancer. Obviously, with chewing tobacco, you also have cancer of the lip, your lymph nodes in your lungs, or not your lungs, but in your throat and other parts of your body can also be affected by dipping. And obviously, smoking would be part of your lungs. The purpose of my speech is to teach you about the different stages, a couple of preventative measures, coping with it, and the aftermath of cancer. This slide shows you different stages. Staging of cancer is a descriptor of how much the cancer has spread throughout the body, or the size of the tumor in the body. So pretty much you have 5 stages really, but the 4 I'm going to talk about are 1 through 4. There's also stage 0, which that we're going to refer to in as far as being part of the cancerous part. Stage 1, it's localized one part of the body. This is the best possible form of cancer to have. Stage 1, anything, is probably your best chance of living. You will be able to go into remission, which is a form of recovery from the cancer. Stage 2, the cancers are still local, but they're advancing to other parts of the area that they're in. Liver, lymph nodes, bones, all that kind of stuff. It's advancing, it's growing, it's becoming more progressive. Stage 3 is also advanced, and the stage depends on the type of cancer. Stage 3 is like a window area. It could be a stage 2 or stage 4 at this point in time. Just depends on what type of cancer it is. Just depends on where it's at, and how much it's grown in the time period that you haven't caught it yet. All these stages up to stage 3, they're all, the recovery rate is good. You're able to recover from it. It can be remission's a very good sign to get in the future. Stage 4, cancers have metastasized and spread to other parts of the body. In fact, my father caught it at a very late stage. Stage 4, most likely stage 4 is a fatal stage. It's not the stage you want to be in. If you've got stage 4, most likely you've had it for a while, and you just caught it too late. There's types of scans that they do to catch these things. What it is like an MRI. You would go into a machine, they put a fluid in your bloodstream, and then it would highlight. It would pretty much like make the parts that are cancerous or tumors glow, so that you were able to see them on the scan. And in the case of my father, every part that they thought could have been cancer was, so it was all over his body at the point in time. There's 6 different ways to prevent cancer, or 6 ways that can help you prevent cancer. Smoking, let's say, accounts for 30% of all cancer-related deaths. 87% of all people affected by lung cancer from smoking. So, obviously, if you don't smoke, your chances of getting lung cancer are very slim. Just because you don't smoke doesn't mean you won't get cancer. It can also affect you in other ways, which we'll talk about. Physical activity. Being obese not only greatly increases your chances of having other diseases as well as other health problems, it will also also increase your chance of having different types of cancer. Being large and out of shape, lack of physical activity will actually lower your immune system and your body's ability to fight off any type of disease, which actually, once you get a disease, your immune system is weakened, it will increase your chances of the more dangerous diseases such as cancer, in this situation. Genetics, cancer in your family, it can actually, if cancer is a normal occurrence in your family, it can actually spread from to your offspring. It just depends on what the type of cancer it is and how you came in contact with it. So not necessarily just because my father has cancer, does that mean I'll get it? No, that's not the case. The case of it is different types, different situations, different types of people can get this from their parents. So it's always good to make sure you take preventive measures to make sure that you're not at risk for this, and to ensure that you're not getting these symptoms coming onto you. Environmental factors, exposure to different types of chemicals within the environment could have a potential lead to cancer. If anybody does construction work, types of wood, pressure treated wood, it's called green wood. What it is it's the chemicals they treat the wood with. It actually leads to cancer. It's a chemical of the chemical, but when you cut the wood, the dust that you can suck in could actually cause different cancers in your body. Obviously, unsafe sex, being diagnosed with diseases like HIV or HPV. HIV, you know what that is. HPV is a human papillomavirus. It affects women, males and females. Can increase your chance of contracting cancer because your immune system is weakened, like we talked about earlier, and makes you more at risk. You get cancer of your lymph nodes, like in your throat, through different types of unsafe sex. Obviously, your other areas of your body that you would use in this type of situation. Sun exposure. Obviously, everybody knows what skin cancer is. Sun exposure can obviously increase your chances of contracting cancer. You can get things like moles, sunburns, can be a sign of cancer. So if you see something abnormal in your body and any of these types of factors, you can always have a chance, of contracting this disease. You just got to make sure that once you see it, get it checked out. Right now, you're currently in the Marine Corps, so we can always get this shit checked out quick, get it nice and free, and they can say yes or no, or hey, let's get another consult and get this done right. So, these 6 different things are, different ways that you can help prevent to help you out in the future. There's several more different types of treatment, but these 4 I've read about, I've heard about, and I've gone through with family members. Surgery, radiation therapy, chemotherapy, and immunotherapy. Surgery, in some, not all instances, when the cancer is able to remove by surgery with the best decision. The location, the stage, the size, and the health factors of the person being admitted for surgery are all determining factors. The person is unable, health-wise, the lungs, the heart can't make the surgery, and they're not going to get the surgery. The tumor is spread to other parts of your body. In the case of my father, he can't get surgery on any part of his body because if they were to cut him open, it would spread worse and it would probably kill him on the table. The location. Not all parts of your body can be removed. They can only pull so much out of your body to where you'll still be able to live and function normally without having to live in a bed all your life. Radiation therapy. What this is you get zapped by radiation for a period of time in a localized area on your body to help shrink the tumor. And by shrinking the tumor will make it more localized so that there could be a possibility of doing surgery in the future or